Hello everyone, lovely to have you here. I'm Sally Davies, Executive Editor of Eon Magazine, and on behalf of the Brochure Foundation, I'm delighted to welcome you to today's meetup on the subject of restricting rights in the name of health. So just a brief matter of housekeeping. Unfortunately, David Carter and Calvin Ho weren't able to attend today, but on behalf of Calvin, we have Carol Carls who will introduce himself shortly, so just a small matter there. I'll provide some brief introductory remarks to start. The webinar is going to last for about an hour. Each of the panellists, who will also introduce themselves shortly, will give a short presentation, and then we'll have time for Q&A and general discussion at the end. So please feel free to drop some questions in the chat, and we'll be able to pick those up in conversation later in the session. So as we all know, the COVID-19 pandemic was a global crisis that required governments around the world to limit many freedoms in order to restrict the spread of the virus and protect public health. These restrictions on rights such as assembly, movement, privacy and more were implemented on an extraordinary scale that was historically unparalleled during peacetime. While it's clear there was an urgent need for significant action, it's equally true that such policies came at a cost and are worthy of critical examination. Today's discussion will examine the legal frameworks used to steer societies through periods of crisis, opening up questions about the relationship between our collective obligations to one another and human rights principles, about civil and political versus economic, social and cultural rights, and about what new insights we can apply when the next crisis invariably rolls around. So with that, I'll just ask each of the panellists to introduce themselves, and then we'll kick off with some brief presentations. So Lisa, would you like to start?
Yeah, sure. Thank you, Sally. My name is Lisa Foreman. I'm an Associate Professor at the Dalai Lama School of Public Health at the University of Toronto in Canada, and I'm a legal scholar. I focus on international human rights law related to health and especially the right to health.
Thank you, Lisa. Katie.
Great to be here. My name is Catherine Young. I'm a professor and Associate Dean of Faculty and Global Programs at Boston College Law School, and I write and research in areas of international human rights law and comparative constitutional law.
Thank you so much. And Carol.
Hi, I'm Carl. A research fellow at the Center for Biomedical Ethics in Singapore, but I'm actually a social scientist. I'm the other one out here, but I'm actually here to represent Calvin Ho, who is the co-director of the Center of Medical Ethics and Law at the University of Hong Kong.
Thank you, Carl. That's great. So to kick off, I think we're going to hear from you first, Catherine. So would you like to start with your presentation?
Sure. Thank you, Sally. Well, human calamities always pressure human rights, and COVID-19 was no exception. We saw pressures across an array of fundamental human rights, from civil and political rights, such as freedom of movement, freedom of assembly and protest, freedom of religious worship and gathering, privacy. All of these came from failures of pandemic preparedness, but also the overreach in many states' response to the pandemic as it was evolving. We also saw pressures on an array of economic and social rights, clearly the right to life, due to the avoidable rates of infection, hospitalization, and mortality, of course. Also the right to health, which we'll come to in a moment, the right to education and particular pressures on children's rights in that respect, the right to adequate social security, housing, food, water, sanitation, and the access to the benefits of scientific progress. We also saw pressures on states' obligations not to discriminate on the basis of race, ethnicity, religion, gender, or other characteristics. And I've listed these as pressures, not as violations of human rights, because it's possible within the human rights framework to limit or restrict human rights on the basis of a state of emergency or calamity or crisis, such as a pandemic. The permissibility of these restrictions are governed by a range of nuanced principles, and it's very important to bear these in mind, so that when such rights are restricted, they should always be restricted because it's necessary to restrict them for a very important purpose, and any restriction is proportionate proportionate. That is, it doesn't overstep the mark and is as temporary as possible, as targeted as possible, and as based as on evidence as it is possible to do in an evolving pandemic. So we're going to speak a little bit more about those principles of restriction. But it's worth noting that these panoplies of human rights that I've mentioned demand a lot from the state and from the international order. And this is from the Universal Declaration of Human Rights from 1948 onwards. But it wasn't until the HIV/AIDS pandemic in the 1980s that the evolving health and human rights framework emerged. And there was a lot of social learning that took place from the disaster of that pandemic. And what public health experts and epidemiologists quickly realized was that HIV/AIDS was entering different countries through very different population bases, and yet it always ended up impacting the most vulnerable and marginalized populations in those countries. And so there was a kind of through line of a lack of access to the social determinants of health, to various degrees of poverty, income disparity, inability to access healthcare, lack of education, stigma, and racism, all of which raise human rights implications, particularly the economic, social, and cultural rights I mentioned. And so these observers during the HIV/AIDS pandemic saw that the human rights framework really offered a common vocabulary and conceptual basis with which to attack the disproportionate impact of the disease. Now, of course, COVID-19 is a very different pathogen, a very different virus, a very different disease than HIV/AIDS, and we can talk about what different vectors led to its disproportionate impact, but the principle is the same. It's been described by some commentators as a pandemic of inequality. It really impacted the most marginalized populations, and it had its own way of discriminating on the basis of certain characteristics such as poverty or ethnicity or race, intra-country and inter-country inequality as well. And this is perhaps its greatest human rights legacy, the impact on inequality that it had. So this is a very important lesson to bear in mind as we look into the future with more pandemics on the horizons, more zoonotic diseases, diseases caused by climate change and the like. But with all of these human rights on the table, if I have time very quickly to introduce a concept we'll probably get back to, and this is the concept of proportionality. That is that these restrictions can be justified under human rights law, and indeed to meet one's right to health, which the human rights framework guarantees that states do have an obligation on to give due accord to everyone's right to health. Then we do have to recognize that that will be restricted on certain bases, as will other rights I've mentioned. And the basic idea of restricting them on a limited basis is pressured, I'd say, from this pandemic for three reasons. The first is that the kind of balancing and tests that have to occur to make sure a right is as least restricted as possible rely on a lot of knowledge and source different epistemic communities. And so with the pandemic, there is the input from epidemiologists, from ethicists, from economists. It's very difficult to grapple with so many sources of knowledge and reconcile them. A second pressure is that on the basis of an evolving pandemic, knowledge, of course, does change. Vaccine access can become a completely game-changing fact that has to be taken into account. So proportionality is an evolving test. And thirdly, we'll get back to this, I think, is the fact that proportionality is a test that helps one to see whether a restriction on a right is justified, but it's much more usual to be applied to a civil and political right, such as the restrictions on freedom of movement, which we saw on such a scale during the COVID-19 pandemic. It's much less likely a framework to be applied to the economic and social and cultural rights restrictions that we also saw unfolding during the pandemic. So I think we'll get back to some of these tensions in a moment, but I thought I'd start there.
That's fantastically helpful, Catherine. Thank you so much for setting the scene. We're going to move to Lisa's presentation now before ending with Carl, who's going to provide a more granular national case study. Lisa, over to you.
Yes, Sally. I wanted to start by thanking you, Sally, and the Foundation Brochure for the invitation to participate in this meetup. I had the absolute pleasure and privilege of completing a residency at the Foundation Brochure earlier this year, looking at similar questions, and it really was one of the most wonderful academic experiences I've ever had. Productive, supportive, peaceful, fun, beautiful. So to anybody who's listening, I strongly encourage health researchers across the academic life cycle, from PhD to emeritus, to consider applying for one of the residencies. So my work in international human rights law really focuses on the relationship between health and human rights. And almost from the start of the international human rights law system, lawyers and policymakers grappled with how to balance the individual rights protections in international law with pressing social and policy objectives, and particularly during a crisis when extraordinary restrictions of rights might be required in extraordinary circumstances. And as Katie said, during the early years of the HIV and AIDS pandemic, these questions really came to the fore around what this should look like in the health context and how you should balance individual rights and public health, particularly because in HIV in particular, in many places, policy responses to the illness often very closely mirrored the prevailing social bigotry around HIV at the time. And we saw policymakers frequently impose unduly harsh restrictions on individual rights that sort of limited public health objectives. A Swiss case is one of the most some famous instances of this, where an HIV positive man was detained for a year and a half, over 7 years, for failing to visit his doctor. And what HIV did really was let us know how important it was to ensure that public health policy struck a more fair balance between a very legitimate public health objective and the imperative to protect individual rights to non-discrimination, privacy, bodily security, and to do so in ways that actually advance public health without exacting needlessly punitive outcomes on individuals. And that what HIV actually taught us was that, in fact, the opposite was true, that what good public health policy needed was to protect human rights rather than to restrict them. This was very counterintuitive at the time, but it was a foundational insight from HIV that really was led to much of the health and human rights research that is done today. And understanding that health and human rights really are fundamentally interdependent in fundamental ways. And very, very quickly in COVID, we saw, it became immediately apparent how deeply implicated the disease and the response to it were impacting human rights. On the one hand, we almost immediately started seeing states use COVID as a pretext to deepen authoritarian rule, crack down on civil society, and limit political opposition. So the most extreme example probably came from Viktor Orban, the Prime Minister of Hungary, who in March 2020 enacted an indefinite state of emergency, which he essentially lifted the rule of law, and that continued with a few interruptions for several years afterwards. Similarly, in Uganda, in that first year of COVID, security forces used COVID during the election, the 2020 election, to break up political barriers, gatherings, clamp down on opposition, and the media, detain LGBT people. But beyond clear abuses like these, there were multiple other areas of human rights concern that became apparent. The first was that as governments imposed stringent lockdowns and travel restrictions, they frequently failed to pay sufficient attention to how to more effectively protect vulnerable populations most at risk of infection and death from COVID. And we saw this most clearly with the elderly in long-term care homes, but similarly with migrant workers, people with disabilities, the immune compromise, to inadequately addressing heightened rates of vulnerability and infection in racialized and indigenous groups, as was the case certainly in the UK and Canada. Another thing we saw were COVID measures that frequently were implemented without adequate social protection nets for people who were most harshly impacted by lockdowns, whose incomes sharply reduced or disappeared. So from inadequate emergency COVID benefits to absolutely inadequate or no sick leave for people who were at threat of potentially being ill, to sometimes inadequate food and other essential commodities for people in poverty or people in prisons. We also saw very severe disruptions globally in access to health services, both because of the limitations on free movement from lockdowns, but also because in many places healthcare resources were diverted from non-COVID care. Massive disruptions in access to infectious disease care, through to primary care, to cancer care, elective surgeries. And in some cases, we saw really significant increases in avoidable deaths because of undiagnosed illnesses. One study found that in Croatia, over 30% more people died of non-COVID causes in April 21 than the year before because of those disruptions. So it became fairly quickly apparent that policymakers needed guidance and clarity on how and where to think about human rights when it came to policy, how to think about restrictions of human rights when it comes to a public health emergency. And the question so deeply engaged, this question of rights and public health and restrictions so deeply engaged public discourse globally, not just because of how extensively COVID measures impacted people's lives, but because COVID became so deeply enmeshed in broader political and ideological culture wars, where everything about COVID became disputed and shrouded in conspiracy theories, from considerations about its origin, its threat, its severity and mode of transmission, to the efficacy of the basic measures we're using, whether we're talking about lockdowns, masks, or vaccines. And this didn't just raise resistance to those measures, but prompted policy responses that sometimes erred on the side of too few restrictions. And of course, if you don't think that COVID is real, then you would find any COVID measure or restriction to be unnecessary and disproportionate to what you perceive as a lack of threat. And certainly if you believe, as many did, that COVID vaccines are dangerous or a conspiracy to implant microchips in all of humanity, you would view a vaccine mandate as a shocking negation of your rights. And in North America, where I live, in Canada, we saw people arguing that COVID lockdowns and mandates, masks and vaccines were inherently authoritarian. In Canada, people argued very, very strongly that any COVID measure, including masks, was a gross violation of the rights and freedoms in the Canadian Charter. But as Katie pointed out, this idea that human rights provide unfettered freedom, it's simply untrue. It's untrue both in international law and in most domestic legal system. There are very few rights that cannot be restricted at all, like rights to life, slavery, prohibitions on cruel and inhuman treatment, but most other rights can have reasonable restrictions placed on them when they are compelling public interest at stake, like national security or public health, and they permit even more serious and severe limitations or derogations in times of public emergencies that threaten the life of the nation. But those provisions are not a free pass for states to limit rights, as opposed to an effort by the human rights system to place limits on limits, so that when states do restrict rights for reasons of security or public health, that they only do so because it's strictly necessary to advance security or public health, and they do so to the least extent possible, and in ways that where public and civil society and other measures of elements of government are able to hold government actors to account for their decisions and hold them to criteria of doing so in justifiable, non-discriminatory, clear, principled, evidence-based ways. And because states frequently didn't do that, we in the international law system came up with a set of principles to guide states. They're called the Syracuse principles, and they essentially say if you restrict rights, they must be strictly necessary, they must be non-discriminatory, temporary, and proportional. In other words, the least restrictive alternatives that could be adopted when several types of limitation are possible. And so those are principles that give some guidelines for assessing the legitimacy of rights restrictions during COVID, and assessing, what is violation, what is pressure that is appropriate, and what is actually inappropriate. So I think, to use COVID as an excuse to lift all rights indefinitely, that's a clear example of a gross violation of those precepts. It lacks necessity, it lacks proportionality. To enforce COVID policy with police brutality also lacks necessity and proportionality. And to do all of this without trying your best to use less restrictive measures, or when those limits are indeed necessary to limit their harshest impacts, and especially on vulnerable groups, that would fall short of human rights standards. But what we saw in COVID, and these are my closing points, the three final points I'll make, we saw the inadequacies of some of the current legal processes. The first was that many governments paid almost no attention to those criteria. And even when they called for explicit human rights or bioethics frames for policy, experts sometimes find it difficult to conceptualize the real-life impacts of policy choices. And this raised really pressing questions about how we respect human rights when decisions are being made hastily and with scarce resources, even more fundamental questions about who should have a say in those choices in the first place. The other thing we found that was that the Syracuse principles themselves were not specific enough about public health emergencies, and they don't give us enough guidance on what proportionality looks like, especially in the fog and the high-intensity pressures of a crisis. And they underscore that what we need are much more detailed, stepwise processes to allow policymakers to make rights-based decisions during crises. And hopefully during the discussion, I'll speak about one of those initiatives that I think have been very important developments of guidelines. And then finally, as Katie indicated, we found that when people did consider impacts on human rights, almost invariably they thought only about civil and political rights to, freedom movement, etc. And they almost never thought about the disruptions to healthcare, to education, etc., in terms of economic, social, and cultural rights. And this is something I've come to think of as almost a civil rights bias when we think about the rights implicated in a crisis, almost as if the thinking, certainly going back to the origin of the treaties, was that when it comes to crises, we might not need to limit economic, social, and cultural rights during a crisis in the same way. But this simply was not true during COVID. I'll end there.
Thank you, Lisa. Lots of fascinating threads I'm looking forward to picking up. But before we do, I'll hand over to you, Carl, for the closing presentation.
Thank you very much, Sally. I'm going to put on the slides. Share screen. Right. Okay. So these slides have been prepared by my colleague Kelvin. The first 6 slides are about the context, so I will go through those faster. The context is that actually in Hong Kong, initially the local transmission had been kept very low. That was seen as a success, and but then subsequently, during the first few months of 22, during what was called the 5th wave of COVID-19, the local transmission shot up dramatically and reached, basically in Hong Kong, the per capita rate was the highest in the world at that point. The reason behind this is because there was a high level of vaccine hesitancy among the elderly. So yeah, reaction, we all know that was like testing, tracing, quarantine, masks, hygiene practices, social distancing, travel restrictions. Then of course you had this, in many places apps were developed. And then at some point in mid-21 in Hong Kong, the app was called Leave Home Safe. That app gained a function where you could actually upload your vaccination status. That was, of course, the first step. Then you had restrictions a few months later, where that app became necessary to access government premises, which of course included also clinics and health centers. But that was only the start. Then subsequently, in early 22, in January, the prevention and control of disease vaccine pass regulation was introduced. And then subsequently, more locations were indicated as that way we needed that vaccine pass to enter. And very importantly, restaurants, entertainment premises as well, but then more important places also like religious premises, shopping malls, departmental stores, supermarkets. That was, of course, more important. So and the moment of this is also important. At the height of that fifth wave, when the situation was the most dire, there was a person that challenged the legality of this vaccine pass regulation, and this is where we then can see where that proportionality, how that comes in really. So she actually claimed that the vaccine pass regulation restricted her right to apply for and sit for property agent license exam, thereby causing a loss of job opportunity, her access to wet markets, supermarkets, or restaurants, thereby denying her easy access to, among other things, affordable food and daily necessities, and her access to the courts as an unrepresented litigant. So before we're going to look at the verdict and how the proportionality test was satisfied, we will look first, of course, where these fundamental liberties come from. And actually, the most important basis for this was the Hong Kong Bill of Rights Ordinance, but also the International Covenant on Civil and Political Rights. So these proportionality tests, there are four links. First of all, restrictions have to pursue a legitimate aim. These restrictions must be rationally connected to that legitimate aim, and the restrictions must be no more than necessary to accomplish that legitimate aim. And then the fourth link is a reasonable balance between the societal benefits of the restrictions between societal benefits and the restrictions themselves, asking in particular whether the pursuit of the societal interest resulted in an unacceptably or excessively harsh burden on the individual. And then these two standards of necessity, two levels where you have the reasonableness, no more than necessary, or the manifestly without reasonable foundation. So when we get back to the court judgment, then it is interesting to see that that the pandemic countermeasures to be applied in response to a public emergency, they actually apply the less stringent, manifestly without reasonable foundation, rather than the more onerous standard of no more than reasonably necessary, which already is indicative of a certain interpretation of this test. And so the court found that the three fundamental rights that the applicant sought to premise her claims on were either without basis or misplaced. But so then we come to this to the application of the proportionality test. First of all, the legitimate aim, where the court formalistically satisfied this part of the test as that it was prescribed by law and backed by subsidiary legislation properly issued under the legislation and personal data privacy protection. Then rationally connected to that legitimate aim, the court accepted that the vaccine pass requirements were obviously pursuing that legitimate aim of protecting public health. So you see that there is a strong reference to the public health situation, so the court noted that the rational connection had been clearly set out in the regulation, which provides that the Secretary for Food and Health could make a vaccine pass direction in relation to any category of premises having regard to A, the extent and pattern, whether general or specific, of the spread of the specific disease in Hong Kong or anywhere else in the world, B, the uses and effects of vaccination on reducing the health risks of persons contracting the specified disease, and see the need to alleviate the effects of the specified disease on the social or economic activities in Hong Kong. But it's interesting to see that even then they emphasized that the applicant retained her right to decide on whether to get to vaccinated or not. Sorry. And then we come to the third and fourth part of this test. The court indicated that there was a wide margin of discretion that should be accorded to the government in accessing the legality of COVID-19 measures. Specifically, the subsidiary legislation was deemed not manifestly without reasonable foundation in the light of prevailing circumstances. Then the reasonable balance between societal benefits and restrictions, and whether there was an unacceptable or excessively hard burden on the individual. The court actually highlighted a number of considerations to be specifically important. First of all, the size, population density, and urban setting of Hong Kong. Two, that Hong Kong residents remained highly mobile within the city in spite of the vaccine pass requirements. I think this also has to be seen in the light of a comparison with the mainland China. Three, the limited number of specified premises where the vaccine pass requirements were applied, mainly places with considerable human traffic, often inside and at close quarters, where a higher risk of COVID-19 transmission might be expected. And four, activities and services affected by the vaccine pass requirements were not of absolute necessity, and many alternatives were often available, even if not always at the same cost. And then five, exceptions applied to meet the crucial needs of residents and to limit some of the inconvenience. And six, vaccine pass requirements had a clear expiry date, were subject to regulatory review and could be revoked. And seven, residents were not legally required to get vaccinated. That last point, of course, is interesting because a lot of people did not really understand how, like, for example, if you did not have access to a supermarket, they saw that actually that was such a pressure that you practically had to get vaccinated. But the view of the court on this was quite clear. So then I will give it back to you, Sally. Thank you.
Thank you so much, Carl. So just to recap, so I understand, I'm right to understand that the court in Hong Kong essentially upheld the legal validity of the vaccine pass, contrary to the plaintiff's claim. Okay, very, very interesting. Okay, that's really helpful scene setting. Thank you so much, everybody. I think, a theme that's emerged from these presentations for me is, partly as a historian by training, I am very interested in the ways in which we've been able to take insights from previous crises and pandemics and apply them. And Katie, you mentioned that one of the big lessons of the HIV/AIDS crisis was that whatever the vectors of transmission, that vulnerable communities ended up suffering disproportionately. And yet the sad fact is, it seems to me that despite apparently learning that lesson, it wasn't well applied in the pandemic in many cases. Could you speak a little bit more to that? So why is it that we allowed, once again, vulnerable communities to suffer disproportionately, and policymakers weren't capable of rising to the challenge?
Sure, there were a number of reasons, but I think Lisa's really laid out well which vulnerable groups were particularly affected by COVID. The very vulnerable populations that had limited access to healthcare, were living in poverty, had been displaced or were otherwise homeless. And there were various measures put in place by some countries. There's a vast list, actually, of such vulnerable populations, and they do differ in different contexts, although there are some common denominators, such as poverty. So states which decided to impose eviction moratoriums, for example, as occurred in many states in the United States, were able to alleviate some of the burdens of a pandemic coursing through society. So there were various policies that could be put in place to prepare for the disproportionate impact of the disease on particular groups. There were also early lessons of what it would mean to be in an elderly care residence or incarcerated or otherwise being required to live in close quarters. And a lot of those alleviating policies were not implemented very early. So the record is pretty dire, actually. And one can think about which epistemic communities were informing particular public policies as one reason. Perhaps vulnerable groups were not appropriately catered for. I think it's really helpful to see the concrete case study that Carol represented here in Hong Kong, because of the very careful way that a court can scrutinize the policies that a state implements and decides to implement and think through whether they're justified in particular scenarios or not. It's really nice to see what a court has laid out before it. I think very early on, many states were making decisions on the fly on the basis of very limited knowledge, although those states that did act to suppress the spread of disease very early were really at an advantage in terms of mortality rates in COVID. It's very striking. It's also striking to know just how enormous the restrictions were. At one point in the pandemic, about half the world were in some kind of lockdown or being forced to stay at home or isolated at home if they had them. And that's extraordinary when we reflect on just how much state control was kind of affected during this pandemic, and then what impact that would have on so many individual lives, particularly those who are vulnerable, who then suffered limited access to income, to food, to water. I mean, these are the vulnerabilities that really come out through a human rights analysis. So as I mentioned, one can look to the epistemic communities that inform this approach, but what the human rights framework from the AIDS pandemic onwards attempted was to bring different communities together around a common framework. That framework being, that all humans have a moral equality and dignity and need to be considered. I think it's helpful then to think through the tests that tribunals or courts can apply when they scrutinize public policies, because that test of reasonableness that comes out in a proportionality analysis, which is this policy reasonable, does have within it a kind of sense that, well, it's not reasonable if one particular vulnerable group is completely thrown under the bus. Reasonableness is a capacious enough notion to understand that. I'll leave it. Perhaps Lisa will have something to add to this.
I mean, this seems to tie very nicely into something Lisa was talking about with the Syracuse principles, which I understand, correct me if I'm wrong, Lisa, but in the instances where rights are to be respected, rights are to be restricted, the measures must be necessary, temporary and proportionate. And you mentioned that in light of the failings of policy in the COVID crisis, or perhaps the pressures that policymakers came under, that there are various initiatives to modify and extend those guidelines. So perhaps this would be a good moment for you to speak to that point.
Yeah, absolutely. So the Syracuse principles were developed in the 80s by a group of international experts because there was just an extraordinary amount of abuse of some of the mechanisms in international treaties to restrict rights where states were in military dictatorships or otherwise really abusing those restrictions, and it became clear that we needed more guidance. So the Syracuse principles came from outside the UN system and took, sort of principles from domestic systems and that were present within the international system to articulate a set of guiding principles for states and courts to follow when making these restrictions. And so, the idea of necessity, that they must be strictly necessary to meet those objectives, they must be temporary, proportionate, non-discriminatory, those came out of that initiative. And they've been extraordinarily influential. The Syracuse principles are now spoken of as if they're a part of international law. They've been adopted and integrated into the interpretation of the treaties. But, these were designed to interpret parts of the Civil and Political Rights Covenant, the International Covenant on Civil and Political Rights. They very explicitly weren't extended to the rights in the International Covenant on Economic, Social and Cultural Rights. There are a lot of different reasons for that, including the fact that those treaties were drafted when the drafters sat down to create those treaties. They thought of these sets of rights as completely different. There was a lot of political contestation too around the Cold War that came to, I won't go into all of the details, but it really had an impact that continues to this day in terms of how the treaties treat the respective rights. What we saw in COVID was that when it came to the rights that governments had signed on to and ratified in treaties, that they'd codified in their domestic constitutions, all of the high-minded aspirations of rights, all of the beautiful rhetoric about solidarity, collective, sort of global health equity, in many cases, it shockingly fell to the wayside. I mean, I think one of the things we're not mentioning here, because we're so focused on the domestic response to COVID, and I think one of the most shocking instances where we saw an absolute lack of attention to, how do our actions as a government impact other nations, was around vaccines. I mean, we saw it early in the pandemic around a lot. There was a scrabble for resources with very limited, absolutely no regard sometimes to how that impacted on the country next door to us and countries across the world. Maybe some of that makes sense when you are in crisis. Maybe that is but I think it's absolutely appropriate that we hold governments to do better than that. So one of the things that almost immediately happened were that human rights lawyers scrabbled to try and apply Syracuse more pragmatically, more tangibly to public health. And an initiative that produced a really fantastic set of principles and guidelines, human rights principles and guidelines for public health emergencies, came out of the Global Health Law Consortium and the International Commission on Jurists. It's a really detailed, very thoughtful document that takes those principles and very, very carefully applies them in a range of different domains. I'll put the link in the chat when I'm done with this, so for people who want to go and look at it. And for anybody who's interested, I think it's a really, really detailed account of and guide for governments on how they should take better care to bring human rights principles into their decision making in a range of different domains, and bring an attention to evidence, clear process, and merge that with attention to principles of human rights, non-discrimination, care for the vulnerable, proportionality, etc.
It's fascinating because, I mean, it seems to me that, there's a sort of failure to weave together the principles to which many governments have signed up and then the actual implementation in practice, especially in the psychologically pressured moment of a crisis. And, I think it's also interesting to reflect that at the time it seemed to me that, particularly in the early days of the pandemic, the notion of kind of a right framework where certain rights may need to be traded against other rights, and for this to be considered holistically, it was almost impossible discursively to talk about it in those terms. And I think if you go back to that moment, it's almost as though if you put it in rights terms, it's almost as though the right to life, but for some governments at least, trumped any considerations of trade-offs against other rights. So does that historical fact, if you agree with that description of some countries at least, does that suggest we need kind of more and better rights discourse or better rights education or sort of more pragmatic application of these principles, or does it speak to a limitation in using a rights framework to respond to these sort of events?
Well, if you ask a human rights lawyer what we need, they always say we need more human rights. That's our hammer, and that's the tool. But I think it's patently clear that we do. We need better protections. We need better ways to realize those protections, and we need better ways to hold governments to account. I think the Carl's the case that Carl presented is a fantastic instance of how those protections can play out in practice, for better or worse. Whether, there's no, everybody has those protections, everybody can claim them. It's not to say that only the right, and I'm not saying this was the wrong case to go to court, but it's appropriate that some of those determinations are played out in very detailed, thoughtful, considered ways in courtrooms. Sometimes that is the appropriate forum. I think it's extremely important that there are mechanisms beyond courtrooms to ensure that policymakers pay more attention to their human rights obligations, and that we as individuals and communities understand both our entitlements and our duties. I think, sort of one of the things that was really disquieting out of COVID was the notion that people hold entitlements, but not responsibilities to other people. And that is a balance that I think we need to be a little bit clearer about.
Oh, go ahead. Sorry, Katie.
I'll just add very briefly then that I totally agree about the emphasis on responsibility and obligations. I might disagree a little bit with the idea that human rights commentators are always wanting more human rights, because there is a kind of recognition that rights talk is not a free pass, and that rights, although it's a galvanizing discourse and open to many new communities to vernacularize their claims in a way that can be transmitted to an international audience, it can also be abused and misused. So I've written recently about a misappropriation of human rights discourse. It's very easy to say my right is worth more because it's my right, and then affix it to something that one person may hold very dear. That doesn't immediately mean it's a reasonable claim to make on society. And so there is some need for literacy, just as there needs to be literacy around health and what a vaccine represents and what a disease represents. So too there has to be some kind of education about rights, what rights talk actually entails, what responsibilities actually entails. So I just wanted to add a little footnote to that idea of more and more rights.
Yeah, very interesting. I mean, it is, that some of the way these discursive battles played out, and I mean, Katie, you were talking about and you too, Lisa, about the imbrication of the culture wars with vaccines and the pandemic itself. And, you had this kind of equal and opposite reaction where, either side, if you will, in any of these pseudo debates would kind of justify its position in terms of rights. So that seems to speak to what you were talking about, Katie, which is, more rights talk isn't necessarily going to be advancing humanity's collective interests unless it comes with that sense of literacy about the substance and the content and what we actually mean. And perhaps this is a good moment to switch gears slightly. I mean, I think it's very important, obviously, to talk about the role of misinformation and denialism and how that affected policymakers' abilities to be effective in the pandemic. And I wondered perhaps if it would be worth comparing and contrasting the effect of misinformation and conspiracy in this pandemic compared to the kind of misinformation, for example, that circulated during the AIDS and HIV crisis. There are obviously a few things I can bring to mind that obviously make the current historical moment different in terms of how misinformation spreads, but I wondered if any of the panelists wanted to speak to that point. And then, of course, off the back of that, to think about, well, how can we effectively deal with misinformation without, in turn, disproportionately restricting a right to free speech, for example?
I'm glad to respond to that. I mean, I'm not a historian, and I think health historians will have much clearer answers to this. But I think we know. I think all of us learned that there were very comparable conspiracy theories, misinformation around the Spanish flu, the pandemic. Sort of in the 1918 pandemic, and certainly during HIV, there were conspiracy theories and really harmful misinformation in places around how people could prevent transmission misinformation, things that really harmed people in a range of different ways. But I think what is maybe qualitatively different in COVID is the technologies that we now have, and the way in which so many of us get our information, not just through formal official news media, but through social media. And I think there's been a lot of work that has looked at the way in which social media's business models and algorithms actually encouraged misinformation and did very, very little to stem very highly inaccurate, really damaging information. And to the extent that people are speaking about this having been an infodemic, that the extent of misinformation and disinformation was so great that they're thinking of it in pandemic terms.
Interesting. Carl, do you want to jump in there?
Yes, I would like to highlight currently WHO is working on ethics guidelines for social listening. This is a really huge problem, and in the discussions around that, so many problems come up. For example, like misinformation. You can, for example, have like this huge project on social listening where you collect lots of data on like social media monitoring and such, but and then process this data to distill like public health interventions to counter this misinformation, disinformation. But then, for example, you've got a problem like, for example, these huge social listening campaigns. You can only basically these require enormous amounts of resources. I'm not sure how many countries can actually effectively do this. Another problem that has come up as well, for example, is what if it is actually the government that is actually misinforming? Let's talk about Brazil, for example. So I think this is an incredibly rich topic. Actually, I think it deserves a meeting on its own.
It's interesting you raised this about governments themselves being sort of vectors, if you will, for misinformation. I mean, one question I had actually off the back of a case study you presented of this, specific challenge to the Hong Kong government's vaccine pass legislation is just recognising too that, I mean, it must be incredibly politically difficult for a court in a moment of global crisis to strike down a legislated policy by a government. And so whilst it is, as Lisa said, very important for the operation of international law that these frameworks be litigated, that the principles be explored, kind of irrespective of what the outcome is, because it shows the importance of that being a standard to which policymakers' decisions are sort of measured. But nonetheless, in a way, you would think, okay, this is sort of the predictable outcome in the sense that it's very difficult for courts to go against the government in those moments. And I'd be curious to know from the panel just whether there were any examples of this about where, for good or ill, national institutions were capable of sort of pushing back on either government's failure to act in the case of evident need or government's overreach in their implementation of policy.
I'll speak to that's a broad framework that's been proposed by many human rights commentators that in assessing a government's record in respect to COVID-19, indicators have to range from not only civil and political rights compliance, but also economic, social and rights and cultural rights compliance, as well as non-discrimination principles, compliance or compliance, and rule of law measures, because these are seen as absolutely key to all of the above. And so we do see courts step in, and not always, but independent courts can provide that ballast. particularly against kind of populist power grabs, which the pandemic did invite, and the use of very divisive rhetoric, but also a kind of anti-scientific position. A lot of these anti-science arguments, because they were not based on evidence, wouldn't see the light of day in a courtroom, because a court can't normally act or usually act on principles that are made up or not fact-based. And so these rule of law indicators have become very important in assessing the records of particular countries. Some countries have risen up very well, others have, as Lisa mentioned, really not risen up well in relation to the rule of law indicators and the strength of the rule of law during the pandemic. And this is interesting, given pandemic means a disease of the people. It has a kind of common etymology with democracy, the demos, and yet this isn't a disease for all the people. It could be used very divisively as a kind of us versus them strategy, where us is a kind of welfare of people that are deserving of protection, and it's usually very vulnerable people, often outsiders, immigrants and so forth, that are actually not included in the protection that a government is ready to extend. So this kind of rolls into the kind of the populist or authoritarian moves that we did see during COVID-19.
Very interesting. And something you mentioned there that I had wanted to pick up before we ended, and just conscious we're coming to the top of the hour, but you place particular emphasis, Katie, on this kind of differential treatment of civil and political rights versus economic, social and cultural rights. And I mean, this is obviously something that goes back right to the creation of these rights regimes within the UN system. But I was curious to hear more from you about, well, I guess it's a two-pronged question. One, why there was this differential treatment in how human rights regimes and governments were capable of grappling with these rights. But two, on a slightly more optimistic note, are there examples that you saw unfold in the pandemic of governments that were particularly capable of integrating the economic, social and cultural rights into that balancing act, including civil and political rights?
Yes, well, the Universal Declaration obviously tried to tie economic, social, cultural and civil and political rights together, and there was an understanding that freedom from want was just as important for international peace and security and for human dignity as civil and political rights. As Lisa mentioned, for various reasons, including the Cold War, economic, social and cultural rights were demoted in the international regime, but we've seen many countries constitutionalize economic, social and cultural rights. Even back in 1917, certain countries were doing so. So these are absolutely now standard in many constitutions around the world. So courts are becoming involved in attending to economic, social and cultural rights alongside civil and political rights. The UN doctrine is one of indivisibility, that all rights are indivisible and interconnected, that neither have priority over the other. And so it's not the fact that economic, social and cultural rights would necessarily stand above civil and political rights, but these are indivisible and interconnected. So this is the kind of United Nations doctrine, and it appears in many treaties. And so, certain examples of countries doing very well, I think this comes to kind of the early suppression of the disease and certain advantages of geography, and a large degree of luck often played into this. But New Zealand, or Aotearoa, has been described as, acting very well in suppressing mortality numbers very early in the pandemic with really minimally restrictive measures. Of course, it has the advantage of being an island state, but other island states did not do as well in relation to the pandemic. That's one specific example. But as Lisa says, we have to think generally about extraterritorial obligations, kind of obligations of international assistance and cooperation. So as well as a country does to its own inhabitants, we have to think, well, is a country actually extending its own resources to resolve the lack of vaccine access or the disparate impact of the disease, particularly in countries with weak social protection systems. And that kind of then sets in chain a whole series of other measures of how a state is doing, which I haven't applied to my example, but need to be constantly thought about when we think of best practices examples in this area.
It's interesting because I imagine, as I understand it, the notion of states having obligations to non-citizens who are not within their borders is something that it's quite difficult for international law to grapple with. And perhaps that's a whole separate subject, but yes, obviously, of particular note when it came to the unequal distribution of vaccines. Just conscious that we're actually about at the end, but before we signed off, I did just want to ask the panel. I mean, it's kind of a naive question, but what do we feel are the key lessons that we've learned from this pandemic in terms of human rights and health? And are we are we in a better position than we were before? I mean, the question I started this conversation with was kind of a somewhat depressed one about seemingly not having learned lessons from the HIV/AIDS pandemic, and once again seeing the decimation of vulnerable communities. But are there any insights that that governments or the international community have taken away and that we can see are being put into action to be better prepared for the next crisis, such that rights can be better accommodated?
I think we'll be figuring out the answer to that question for a long time to come, because I don't know that we'll be really clear on really the evidence base for some of the interventions, some of the outcomes. What is clear, and what was clear very, very quickly, was that in international law, the paradigms, the frameworks, the instruments that we have are not sufficient. They don't link to each other, and they don't address some of the key areas of preparedness, response adequately enough. And that's why right now what the big kind of international law push is to reform the international health regulations, which we didn't speak about, but that's the primary piece of international law that deals with pandemic response, and to create a new pandemic treaty that fills in some of those gaps. As a human rights lawyer, a lot of us in the human rights community are concerned that there's not sufficient attention to human rights, and there's not sufficient linkage to the human rights system that exists. It's all well and good to create new systems, but if they are going to further fragment and devalue the systems that we already have, I think that could be more harmful than helpful. But certainly I think what we need is better linkages and better protections for human rights in whatever international law we do have.
Interesting. So what I hear you to be saying there, Lisa, is it's sort of admirable, or at least it's good to see that there's a kind of desire to formalise some of these lessons into new treaties, but it's very important that it kind of be interoperable with the human rights regime, rather than creating the risk of a kind of parallel regime with human rights lawyers then scrambling to be noticed in the next pandemic. And it's vital that the principles that this new work sort of crystallises sort of speak to rights and be sympathetic and integrated with human rights regimes. So Carl and Katie, I wondered if you had any closing remarks about lessons you think that we've learned from this pandemic to better arm us for the next one.
Well, perhaps I'll mention this extensive framework of different indicators that human rights monitors, NGOs, others can press on during the next pandemic, which now include civil and political rights, which have long been tracked, but also economic, social and cultural rights, non-discrimination principles, and rule of law principles. And I think that's a very important framework going forward for the inevitable next pandemic. And I would say too that, very raw indicators of countries' performance here have been things like excess death indicators. And the knowledge has moved on so much now to say, well, that there's, we can see how a country performed only in the broadest brush by looking at such numbers. The Health and Human Rights Framework can provide us with so much more information about what the country faced at the time, what measures it took, whether those were proportionate, to give a much better accounting of how a state conducted itself. And that kind of knowledge will go into informing, hopefully, the epidemiologists and the ethicists and the economists and the policymakers in the next pandemic. It's certainly knowledge that's available now, and a lot of scholars and academics have been working on it.
Yes, it sort of speaks to Lisa's point that, we have been able to capture a lot of this raw data, but it's going to take quite some time until we process it and kind of understand how it speaks to the questions we're going to be asking. But hopefully we can do some of that before the next pandemic arrives. Carl, did you have any closing remarks, just as from your perspective as a social scientist, about kind of lessons for policymakers that we should take from this collectively traumatic experience?
Well, yeah, as a social scientist, I can't say much about frameworks and such, but I would like to reiterate something that we've heard several times, and something that actually we already knew, and that's stakeholder involvement. These vulnerable groups really, like, I'll give the example of Singapore, where there was this really massive oversight. In Singapore, you have migrant construction workers, about 300,000 of them, that live in dorms. Nobody thought about that. Nobody thought how they live in such dense conditions that obviously you have massive spread of a virus once it enters such dorms, such dorm environment. And of course, luckily in this case, these were all healthy, fit young men. So the fallout was on that level was not so bad. I mean, in terms of human life, but obviously it was a huge endeavor then subsequently to get that under control. And I mean, what I'm trying to say is also that, like, it's not as if we didn't know, and it's not as if the structures are not in place. There are civil society organizations in Singapore that deal with these communities, such as construction workers, migrant workers. So yes, I think that's a very important lesson that we've, well, shall I say, learned again.
Yes, I think that's a very nice note to close on, and it comes back to the point that Katie made about the kind of epistemic communities who are involved in making these decisions. I think implicitly, fundamentally, the necessity for, you know, using a diversity of epistemic communities in these situations, which of course is very difficult when decisions are being made very quickly and under huge amounts of pressure. But I think the complementary nature of fundamentally ensuring that stakeholders are involved, and that there's a way in which, you know, these policies are not simply top-down measures taken on the basis of a supposedly cool-headed assessment, but that there's a kind of bottom-up voice, that there's an understanding of the lived experience of vulnerable communities, which in fact informs the objective efficacy of these policies. So it's very important for the human rights framework to not simply be a sort of top-down one, but a bottom-up one as well. Well, thank you all for such a fascinating conversation. The webinar will be recorded and available online. And yes, we really appreciate your time and attention on it, and it's been a really fruitful conversation in which I've learned a lot. So thank you all. Thank you. Bye-bye.